This video is going to review the uterine or menstrual cycle, and then we're also going to talk about all four of the various graphs and kind of superimpose them on each other. So, the uterine or menstrual cycle is cyclic changes that occur in the endometrium that occur in response to these fluctuating ovarian hormone levels. So, the estrogens and the progesterones. So the first few days of this phase, as you can see down here on the graph, are the menstrual phase. After that is the proliferative phase, which is the rest of the first half of the uterine cycle. And both the menstrual and proliferative phases do occur before ovulation, so that's important to remember. Together, they correspond to the follicular phase of the ovarian cycle. So the three phases are the menstrual phase, when ovarian hormones are falling and they trigger the shedding of the functional layer of the endometrium. Then comes the growth phase, the proliferative phase, where estrogen levels are increasing to rebuild the functional endometrium. And then finally is the secretory phase. That corresponds to the luteal phase of the ovarian cycle. It's also called the post-ovulatory phase since it occurs after ovulation. And this is the rest of the month, the secretory phase. And also, just a reminder, the proliferative is the pre-ovulatory phase. So on our next slide, we have a little more details about this uterine cycle. The first of which is the menstrual phase, the first few days where the ovarian hormones are at the lowest level. So as a result, gonadotropins start to begin to rise a little bit, kind of as a negative feedback response. So during this time, the stratum functionalis is detaching from the uterine wall and is shedding. So that menstrual flow of blood lasts usually 3 to 5 days. By day 5, those growing ovarian follicles are going to start to produce estrogen. For the second day time period, we have the proliferative, or again pre-ovulatory. So those estrogens continue to rise, and they prompt the generation of a new functional stratum functionalis layer, in case there's going to be eventual implantation and pregnancy occurring. So as the layers thicken, the glands enlarge, spiral arteries increase in number. So ovulation then occurs at the end of the proliferative phase. The last stage of the uterine cycle is the secretory or post-ovulatory phase. And this is the most consistent in duration. So the days before ovulation are not as consistent as the luteal phase. Remember that the luteal phase does correspond to the secretory or post-ovulatory phase. So the endometrium is preparing for possible implantation of an embryo. So the functional layer starts to become a secretory mucosa. Endometrial glands start to enlarge and thicken nutrients. There's also thickened mucus that form a cervical mucus plug to block entry of more sperm after this time period. So after ovulation has occurred. So if fertilization does occur in the uterine tube, that corpus luteum degenerates toward the end of the secretory phase and progesterone levels fall. So if fertilization does not occur, so I want to emphasize not. I think I might have accidentally said does occur. So if it does not occur, the corpus luteum degenerates, the blood vessels fragment, and the uterus goes into another day of menstruation. So the functional layer sloughs off, uterine cycle starts off again for the first day of menstruation. So in this slide, we're going to see all four of these graphs superimposed upon each other. So I want you to notice that the follicular phase here is the first half of all four of these graphs. So whether we're looking at gonadotropins, looking at the ovary cycle, the ovarian hormones, or the uterine cycle, it's corresponding to activity of the ovarian follicle. Also, in the second half of the cycles, whether it's the gonadotropins, the ovarian cycle, ovarian hormones, or uterine cycle, it is the luteal phase events. So, what's important to remember is that LH is going to be the ovulation hormone. Then, when we're looking at the follicle, some follicles are selected here, but at this point, the dominant follicle is selected during the follicular phase. And that dominant follicle is going to surround an oocyte that is diploid, has 46 chromosomes. It's not until ovulation where there is a secondary oocyte, which is now haploid. And remember, it's ovulated and it's arrested at metaphase 2 at this point. So in the third graph here, and again, I want you to see how it relates to the other ones. Just to remind you, even though this says follicular, it's still the proliferative phase, as you can see down here. So you should be able to recognize what happens during those different phases. Also, this green line is referring to the progesterone. This is what is produced by the corpus luteum, which is a structure that is within the ovary that you start to see right here. On our next slide, we have a comparison of the different reproductive hormones here. You don't really need to worry too much about these last two rows, but you should know the source for them. So estrogens come from the ovary, specifically the follicles and the corpus luteum. Progesterone comes mainly from the corpus luteum in the luteal phase. And then testes come from the interstitial endocrine cells, which are also called the Leydig cells. The feedback, or rather the stimulus for the release, is FSH and LH for estrogens, LH for progesterone, and LH for testosterone. The feedback exerted is going to be positive and negative for FSH and LH, or for the estrogens rather, negative feedback for progesterone and negative feedback for testosterone. The effects that they have on the reproductive organs would be the primary effects. So estrogens responsible for growth and maturation of reproductive organs and breasts at puberty, maintain their adult size and function, promote proliferative phase of the uterine cycle, stimulate production of watery cervical mucus, and activity of Fimbriae and uterine tube cells. Remember that FSH is oogenesis, so the FSH is the one that has to do with gametes. Ovulation is responsible for, or LH is responsible for ovulation. The secondary sex characteristics would be things like long bone growth, followed by epiphyseal closure, feminization of the skeleton, and inhibiting bone resorption and promoting female pattern of fat deposition. For progesterone, its primary reproductive effects would be cooperating with estrogen and stimulate growth of the breast, promotes the secretory phase of the uterine tube, which is the post-ovulatory phase, stimulating production of viscous cervical mucus. Progesterone surge after ovulation enhances beating of cilia in the uterine tube. And during pregnancy, it quiets the myometrium and acts with estrogens to cause mammary glands to achieve their mature milk-producing state. You can see that there's no production here, or there's no role that progesterone plays on secondary sex characteristics. As far as testosterone, its effects on the reproductive organs are going to be formation of the reproductive ducts, glands, and external genitalia, descent of the testes during development, growth and maturation of internal and external genitalia at puberty, and maintaining their adult size and function, as well as required for normal spermatogenesis. FSH is really initially still what triggers spermatogenesis, but testosterone plays a role as well. For the secondary sex characteristics, it promotes, after conversion of estrogens to the testosterone, long grown bone growth followed by epiphyseal closure, like the estrogen did in the ladies, increase skeletal and muscle mass during adolescence, promotes growth of the larynx and vocal cords because there are testosterone receptors on the larynx, so there's a deepening of the voice, and enhance sebum secretion and hair follicle that's on the face, axilla, genital region, and chest.